Emily Lawfer?
Yes.
Hi, my name's Adia Johnston. I'm a student nurse. I'll be doing your head-to-toe assessment. Can you go down to room 203? That's where we'll be doing the assessment.
Sure.
As my patient walks in, I notice she has proper gait and balance, is well-groomed, dressed appropriate, and is alert and oriented times
I
3.
have a seat right there. I'm going to wash my hands and shut the door for some privacy. Before we start, can you tell me your name and your birthday?
Yes, Emily Lawfer, 3/13/1991.
Okay, thank you. And before we do like the physical head to toe of the assessment, can I ask you a couple questions?
Sure.
Okay. Do you have any allergies?
No.
Are you taking any medication?
No.
Have you recently just stopped taking any medication?
No.
All right. Do you take anything over the counter that's not prescribed?
No.
Okay. Do you use any street drugs
No.
or alcohol?
Just socially.
Okay. So how often do you think you drink each month?
Maybe 2 to 3 times a month.
Okay. And how many drinks do you have in one setting?
1 to 2.
Okay, that's good. So how's your stress level been? How's everything been for you?
Good.
Okay, good.
Do you have any pain?
No.
All right. And how's your activities of daily living been? Bathing and dressing, have you had any trouble at?
No.
Any changes in your health that you're concerned about?
Nope.
All right, so I'm just going to ask you a little bit about your family history so I can get a little bit of a background. Is anyone in your family a smoker?
No.
Are you a smoker?
No.
Okay. Does anyone have a history of diabetes, hypertension, any kind of endocrine disorders?
No.
Perfect. So as far as lifestyle, do you exercise daily?
I exercise about 3 times a week.
Okay, and for how long?
About an hour.
All right. And how's your diet been? Have you been having a balanced diet? Eating fruits, vegetables, milk?
Yeah.
Okay. And, well, I was looking here, and your BMI is 22.5, which is good. It's in normal limits, so you've been getting a good amount of exercise and a balanced diet. And we also did a fasting glucose on you, which was 70, which is normal.
Okay.
So everything's looking good. Have you had any trouble with your bowels?
No.
Okay. Any pain when you have bowel movements?
No.
Constipation or diarrhea? Okay. And what about voiding? Have you had any trouble urinating?
No.
And would you say you have about 30 milliliters an hour when you void?
Yes.
Okay. And is your urine usually clear and yellow?
Yes.
Perfect. So how's your vision been? Have you seen the eye doctor lately?
Yes. I just thought of the eye doctor.
Oh, good. And what about your hearing? Do you have any concerns about that?
No.
Wonderful. So I just want to know if you are sexually active.
No.
Okay. And have you had any pregnancies?
1.
Yes. How was that? Did you have any complications during pregnancy, delivery, afterwards?
No.
Wonderful. Do you do breast exams at home?
Yes.
Okay. How often do you do them?
Once a month.
Perfect. Have you had the HPV vaccine?
Yes.
Oh, good. When did you have that done?
About a month ago.
Okay. And what about a pap smear? Do you get those done yearly?
Yes.
Well, everything's looking good. It seems like there's no concerns. So I'm going to do the physical part of your exam.
Okay.
So now we'll start the physical part of the exam. I'm just going to start by looking at your scalp.
Okay.
Have you had any pain?
Nope.
Any head injuries?
No.
Well, they look clear. Everything looks good. I'm just going to look into your ears.
Okay.
And those look clear. There's no drainage. I'm going to look into your eyes. Can you look at my finger?
Mm-hmm.
Your face is symmetrical. That's good. Your pupils are round. They react to light. They're equal. I'm going to look into your nose. That looks good. There's no drainage. And can you open your mouth so I can take a peek? That's good. Your teeth look good. Everything's intact, moist. Have you had any problems chewing?
Nope.
Okay. Now I'm just going to feel around. I'm going to feel your temporal pulse. It's present and steady, which is good. It's going to feel right here in your neck. Have you had any problems swallowing?
No.
good. Your trachea is aligned. Your sinuses aren't swollen. Gonna feel your carotid artery. This one I'm gonna do one at a time because I don't want to cut off the circulation.
Okay.
But it's present on both sides and it's nice and strong. Okay. So now I'm just gonna do some range of motion as you look at your arms.
Okay.
I'm gonna take a little peek. There's good. There's no lesions. How's your joints been? Any joint pain?
No.
Oh, good. You have good muscle mass. I can tell you've been at the gym. Can you squeeze my hands? Great. Okay, I'm just going to have you follow my movements.
Okay.
Can you reach out in front of you? And then out, up, and down. Wonderful. Okay. I'm just going to feel for your pulse, your brachial pulse right here. That's good. And your radial pulse. That's great. Just going to check your capillary refill. Less than 3 seconds, which is good. I'm going to do the same on this side to make sure both sides are well.
Okay.
Do your brachial again. Your radial, it's good. Check the refill here. Okay. Just going to check your skin turgor. It's good. You've been drinking a lot of water, huh?
Mhm.
Tell. That one's good. I'm going to check the reflexes in your arm next.
Okay.
You can just put your arm in mine. Thanks. That one's good. That one's good too. Okay. So that's looking great. Everything's good. Can I take a look at your chest?
Sure.
Listen to your heartbeat.
Everything looks normal, symmetrical, resting rate 12.
Let me just feel around. Have you had any trouble breathing lately?
No.
Any shortness of breath? Coughs? Okay. Just gonna take a listen. Okay. I just have to feel for your second intercostal space.
You have normal breath sounds.
Right now I'm gonna listen to your aortic valve. Sounds good. I hear your S1 and your S2. I'm gonna go over to the left of your sternum. Listen to your pulmonary valve. That one's good. The intercostal space is down. I'm gonna listen to your Erb's point. That sounds good. And then 4 down on the left of your sternum. And listen to your tricuspid valve. That's great. And then I'm gonna come down here and listen to your apical pulse. And I'll just listen for 1 minute. That sounds good. You have 60 beats per minute, which is wonderful. Okay. I'm just going to listen to the front and listen for some respiration.
Okay.
Everything sounds clear. So if I can have you just face the window over there.
Sure.
You can sit down in the chair.
Okay.
Just going to take a look at your back. Feel around your lungs. Do you have any pain?
No.
Okay. That looks good. So I'm just going to listen to your lungs.
Okay.
Just going to feel through your scalpel. I don't want to put my stethoscope over that. I won't be able to hear. You can take a deep breath. lungs sound clear. There's no problems there. As you breathe in, I just want to feel, so I can feel if your lungs are even. Okay, can you take a breath? That's great, thank you. Okay, if you can just turn your chair for me. Okay. Okay, I just want to check the reflexes in your knee.
Okay.
So if you can just relax your legs. Just gonna give it a little tap. Okay, that's good. And that side looks good too. And if I can have you stand up for me.
Okay.
And if you can rest your foot on the chair like this, I'm gonna check the pulse.
Okay.
The reflex in your foot. That one looks good. Can you do the other leg for me? Great. You have both reflexes, they're good. I just want to check your spine curvature, so if you could just touch your toes for me. Okay, there's no problem there. That looks great. Now if you can just lay down right here, I'm just going to listen to your belly, neck.